18-year-old female present with clinic with progressive pain in her neck and back. The condition has been progressively worsening over the 6 months. She is not present previously because she was an inpatient with a disease of failure of ulcerative colitis. So a patient is suffering from the ulcerative colitis. On examination, she has a stiff back and limited spine extension on bending forward. What is the most likely explanation of the process? That means a patient suddenly develop the back pain and neck pain, and the patient also has the ulcerative colitis and stiff back with limited spine extension on bending forward. That means there is the function of the spine is reduced. What is the most likely explanation? Here the options are spondylolisthesis, spondylolisthesis, functional scoliosis, Sjögren disease, and ankylosing spondylitis. So first of all, let's see the ankylosing spondylitis. In case of ankylosing spondylitis, the fusion of the spine occurs. That means the intervertebral disc between the two vertebrae, they are fused on another, and the other ligaments such as the anterior longitudinal ligament, posterior ligament, longitudinal ligament, the ligament also inflame, and there is the fusion of one spine to another spine. That means the joint become stiff. For this condition, forward and backward bending of the spine, also the lateral bending is restricted. That means reduce. Also here we can see this is the plantar fasciitis. So also there is development of the plantar fasciitis. That means inflammation of this plantar fascia. Also there is the inflammation of the costo-sternal joint. Here this is the costo-sternal joint. So costo-sternal joint, they are also inflamed. Also there is development of the uveitis. So these are the clinical feature of a ankylosing spondylitis, and the most severe form is when it affects the spine. That means first of all sacroiliac joint involvement occurs, and then rest of the spine. That means the from the neck area up to the lower part are involved. That most of them are involved the cervical and thoracic spine, but before this SI joint, that means the sacroiliac joint involved. So what is the ankylosing spondylitis? Ankylosing spondylitis is an autoimmune process in which there is deep inflammation of the fibrous structure in our body. So the ankylosing spondylitis, it is a chronic inflammation which affects the axial skeletons. So the mainly the spinal vertebral column, and most of them are sacroiliitis. So first appearance is the sacroiliitis. That means the low back pain, and it is usually visible in the plain x-ray, but sometimes in early phases in plain x-ray there is no sense. In this condition, MRI is the best option. And HLA B27 is the one of the investigation, and it present up to 20% of the case. And affected articulation develop bony or fibrous changes. So mainly fibrous changes, but sometimes there is the bony changes. And what occurs, it fuse one vertebra with another vertebra, and there is limited the movement or reduced movement, and finally there is loss of the movement. Typical spinal feature include loss of the lumbar lordosis and progressive kyphosis and cervical thoracic spine. That means cervical and thoracic spine then involved. Ankylosing spondylitis is associated with HLA B27 about 20% of the case. There is a strong association with ulcerative colitis. So this point is very, very important. That means a patient who has the ulcerative colitis, and also there is limited of the spinal movement or vertebral column movement. In this condition, the diagnosis is ankylosing spondylitis. The clinical feature usually the kyphosis affecting the cervical and thoracic spine, and what is using the NSAID, that means the non-steroidal anti-inflammatory drug, usually used in this condition to reduce the pain. and sometimes steroid also be used. But this NSAID when using their special attention give in case of the inflammatory bowel disease, because in inflammatory bowel disease NSAID should be used very cautiously. So what is our answer? Our answer is the ankylosing spondylitis. Why ankylosing spondylitis? First of all, there is association with ulcerative colitis. Second of all, there is the limited spinal extension and bending forward. That means limited spinal movement. So when there is ulcerative colitis in history and limited spinal movement, in this condition, diagnosis is the ankylosing spondylitis. Other option here such as spondylolisthesis, functional scoliosis, Scheuermann syndrome, they are the regional involvement. That means it usually involve the lower lumbar area, not other area. But in case of ankylosing spondylitis, it affects the whole of the spine.